Now, I know you speak at a lot of industry events. What are some of the most exciting innovations or trends that you're thinking are going to shape medicine that you're
Yeah.
focused on?
Well, I do think that, when modern medicine was invented, which was really like the early 1900s, in that era, treatment of disease was the crushing need of humanity, right? Like there was no point in having sort of rejuvenative or aesthetic medicine because we were dying in our 40s, so you got to fix the first problems first, right? So modern medicine really evolved with this goal of treating disease, and we've been wildly successful, right? We've doubled the human lifespan. That's an incredible achievement. Um, but we are getting to, at least my perspective, my opinion is we're starting to get to the end of what disease care can do, right? And we are, and what I believe will be the next major, or one of the next major changes. Of course, the immunotherapies, those are absolutely huge, and there's some things that are coming there that are amazing. But we are starting to realize now we've got this doubled lifespan. Now we're trying to figure out how to make those years healthy years, through the use of preventative medicine. And this is true. I see this in aesthetics, and I see this in the sort of longevity conferences that I attend. They're kind of growing together like this because if you think about aesthetics, the way aesthetics started, and the way that I would say 85% of it is done now, is we are using tools to make tissue appear better, right? You inject like toxin. I do Botox, obviously. Like I'm like an alcoholic that opened a bar. Like I do all the things, right? So when you put neuromodulators or Botox into skin, what you're doing is it's a relaxer. It relaxes the muscle, so the muscle can't pull at the skin and it can't make lines, right? Well, you're not solving the underlying problem. The underlying problem is that the skin has lost its ability to repair itself and lost its thickness and lost its strength. But you're making it look better, but you're not solving the underlying problem. Over the last 10 years, and most of aesthetics is kind of like that. Over the last 10 years, what I've been seeing is more and more regenerative therapies, where we're actually, instead of using something artificial to create a look that appears more youthful, we actually are starting to have these interventions now where we can actually make the tissue youthful again. And you see that in aesthetics and you see that in longevity medicine both. And that's really cool, because one, it looks a lot better, right? A lot of the problem with some of our older therapies is they didn't really look natural because they weren't. I mean, go figure, right? But we're starting to be able to do that, and that's where I think that this branch of medicine, anyway, is going is away from sort of synthetic interventions and towards sort of biological regeneration, which is really cool. Just really cool medicine. It's fun. It's so fun to be at the forefront of that. That's is really neat. So that's what I think.